And what you see is redness and swelling and pain and heat. That is the classic sign of inflammation in the body. We used to call that in medical school rubor, dolor, color, and tumor. Tumor just means swelling, not tumor, it's anyway, Latin, whatever. But the key is that it's this normal process that happens as a result of dealing with problems that go wrong. But here's the rub. In the past, most of what we had to deal with was acute things that caused inflammation, like a cut or an infection. But today, our modern lifestyle is driving so much hidden inflammation, systemic chronic inflammation, silent inflammation. It's a silent killer. And it turns out that it's not the kind of inflammation that we are familiar with, like a sprained ankle or a sore throat or something that's an obvious kind of inflammation, the kind that's good. The kind we're talking about is the kind that's bad and that leads to almost every known disease of aging: heart disease, cancer, diabetes, Alzheimer's, not to mention things like ADD, depression, obviously autoimmune disease, obviously allergies, asthma, all sorts of gut issues. All these problems are caused by inflammation. Of course, then the question is, what causes inflammation? We're going to get to that. So from a functional medicine perspective, I don't care that you're inflamed. I care about why you're inflamed. I don't want to give you an immune suppressant, an anti-inflammatory drug, a pile of aspirin. I want to find out what the cause is and get rid of it. In functional medicine, there's a simple rule, and it's this. It's called the TAC rule. If you're standing on a TAC, it takes a lot of aspirin to make it feel better. Take out the TAC. And if you're standing on 2 TACs, taking one out doesn't make you 50% better, so get rid of both of them, okay? And all of them. Maybe there's 5 or 10 TACs, and that's the secret of functional medicine. It's a method of investigating the body as a system, looking for root causes, and getting the body back in balance. All right, so what is the deal with this inflammation? Now, I think when I was in medical school, heart disease was a plumbing problem.